My area of research is vestibular imbalance disorders. And I was charged when I was in grad school. I had a friend of mine who was going through his ER rotation in med school, and I was starting my graduate program in audiology and had a real interest in vestibular imbalance disorders. And he was explaining to me that as I was talking about a love for balance, he was seeing patients come in for hip fractures and seeing the other side of what can happen when the balance system breaks apart. And he charged me with trying to help these individuals. And that's really what started getting me to think about falls and how we need to address this medical concern. And really thinking about all aspects of falls. So falls are not just the physical effects, it's also the emotional effects. And that is what led me to looking at fear of falling, which is often can cause falls, and it's so apparent in older individuals who even have not experienced a fall. So that's really what led to my desire to do this work. And this work was actually part of my PhD dissertation and just kind of morphed into this paper. So the project itself was really thinking about, I spent some time looking at what's current with how we identify fear of falling. And we have some very good validated scales, but the validated scales only tap into situations that may be apparent for some individuals. So situations such as walking on an icy sidewalk. Well, there's so many older adults who avoid this just because they're afraid that they might fall. So it really led me to think, well, what can we do to really dive into what are their perceptions of fear? And what can we do to better address their concerns to have better success with our outcomes? Well, for the work, and as the title implies, it's really looking at the impact of fear of falling for not only our patients, but their loved ones who are often thrown into a caregiver role. So with my study, I had 14 patients who I interviewed, and then I interviewed 14 of their spouses or family members who were put into this scenario of being a caregiver. And what I found was very surprising with the study is that there were differences with respect to age of the patient and with respect to age of the caregivers. So with a matching of an older patient and older caregiver, often they just felt that this concerns of falling and restriction of their activities is just part of life. So they both were very much on the same playing field. It was very congruent in how they felt about this natural progression and the decline of their activity levels and things of that sort. Whereas for my younger patient groups with their younger loved ones that I interviewed, they often had incongruencies in their concerns and their perceptions, where the patients who were very concerned with their falling and had expressed a true fear of their falling and experiencing this again, and their loved ones just couldn't understand where this was coming from. They didn't have an appreciation for why this individual was restricting their mobility and why they were so concerned. So I think in thinking about rehabilitation programs, there was for outcome for these patients, there was struggle at home. And because of that, they didn't have the same success with rehabilitation. And without having an appreciation for the perceptions of both the patients and their loved ones and addressing those, we're not going to be successful in the end. My line of research with falls is still taking off. For the larger study as a whole, there was more of an aspect of the physical therapy portion and what they actually did in the rehabilitation program. And the paper is on just their emotional reactions and their perceptions from the program. So I'd say, kind of in thinking about the next line of work for me, it's really working with more of the collaborative approach and working with, I have a study that's going to be starting this spring with psychology and physical therapy, and I have an fMRI specialist, and we're really going to be looking at an eye tracking specialist, and we're going to be looking at older adults with fear of falling without, and really tying in emotional responses, neurocorrelates with fear of falling, differences in gaze patterns for patients with fear of falling versus not. So we're really collectively coming together as a team to really fully understand the psychology and also changes in not only their functional mobility but their brain circuitry for those with fear of falling. So this is an ongoing work for me.